So just to go back to some basics, the heart is obviously a muscular pump that pumps all the blood to the body, recirculates back to the heart, and gets pumped out again. Your heart is working hard over many years. It beats an average of about 100,000 times a day and pumps about 2,000 gallons of blood per day. You see the right side of the heart, this blue side, right? The heart's separated into halves and then top and bottom on each side, so 4 chambers. All the blood that has traveled to the body, let's say, is going to come back to this right side of the heart. And there are these 2 vessels that are coming to the right atrium. You see the right atrium is labeled. All that blood comes into the right atrium, goes through a valve into the right ventricle, then goes to the lungs, where it gets oxygenated, has to carry oxygen to the body and all the tissues. So it goes to the lungs, gets oxygen, and all comes back to the left atrium, that top chamber on the left side. Red sort of depicts oxygenated blood, right? Then it goes through a valve called the mitral valve into the left ventricle, which is that main pumping chamber that we're very concerned about. That main pumping chamber is pumping all that blood to the body, all from that main pumping chamber. It goes through the aortic valve, which we'll talk about a little later. That's one of the not so uncommon things that can go wrong in the heart. Some valves can malfunction. The arteries of the heart are a critical factor. So when blood gets pumped out through that main pumping chamber, through the aortic valve, it's going to travel to the body. It also travels in the closest place it travels is, you see, it takes off with the vessels that feed the blood to the heart muscle itself. It needs blood also. So those come off right away as soon as it comes out of the main pumping chamber. And there's one main artery on the right side and a couple of main arteries on the left side, each of which has its own branches. And what I'll point out here also, if you can see that diagram, that depiction of the arteries, these arteries run right on the surface of the heart and feed blood into the heart muscle. Every part of the heart muscle needs blood flow to be able to work properly. So what happens when you look at those risk factors that cause blockages, high blood pressure, high cholesterol, diabetes, smoking, that you can start to form blockages in the tube of the artery. And you can see how it could progress, and you see the bottom picture there. It can progress to a degree where it really diminishes the blood flow to a certain area of the heart. If that narrowing is 70% or more, it's going to start affecting how that heart muscle works. And of course, if you close the blood flow to that area, like a blockage progresses to 100%, that will generally, that's a heart attack. And that's when you're killing off an area of heart muscle. So coronary artery disease, that's what we call that, right? And that's the most common cardiac abnormality and the biggest reason why why there's a high cardiovascular mortality is mostly from blood flow issues. When you get blockages in the arteries, you can develop angina or chest pain. Or like I said, if that narrowing progresses to a degree where it completely closes, that's what we call a myocardial infarction or a heart attack. Valvular disease is another thing that can affect your heart muscle. Now, if these things are fixable. If we find them early enough and prevent the damage, we can diagnose and fix these problems. We have a lot of good technology. But if they don't get fixed, or you come in at a point where you've already done a lot of damage, which can happen, because chest pain can be a warning sign, but not everybody gets chest pain. Not everybody gets that warning sign. Their first presentation might be a big heart attack, right? They weren't having chest pain progressing to a heart attack. They might just show up with a heart attack, which is one of the reasons why it's so important to get checked routinely for the risk factors and for these problems. If you start to damage your heart, you can develop heart failure and arrhythmia or abnormal heart rhythms, which really start to shorten your lifespan and your quality of life. So angina, like I was saying, is when an artery narrows about 70% or more, you're diminishing the blood flow to a certain area, and that area of heart muscle is not going to work as well. This picture over here down at the bottom is an X-ray picture, right? So when I'll go through how you might end up getting this picture done. It's done in the cardiac cath lab of the hospital, but we use X-ray, and we can inject with catheters into the arteries and visualize them directly. And the arrows are pointing to some irregularities in the artery, right? We could see that that's how we find blockages more directly. There are areas that are not blocked and are bigger, and then you start to see some little narrowings, irregularities, bites, right? Those represent blockages. Angina can start out, like I said, you might not get any angina at all, but if you get angina, it might start out as what we call stable angina. So typical angina is when you exert yourself, you get a tightness or a pressure in your chest, and then you stop and it goes away. That's what we call typical angina. Not everybody gets any angina at all, and some people get atypical symptoms, like they might get indigestion. That could represent angina, or pain in their shoulder or arm can represent angina. You'd never know. So again, kind of goes back to getting checked, making sure you're controlling risk factors and getting checked with testing. Regular angina could progress to what we call unstable angina, which is you could start to develop chest pain even just sitting around at rest. Not even when you're exerting yourself. Technically, that means the blockage has progressed to a degree where even just at rest, it's not letting enough blood flow through to the heart muscle. Again, if we're going in progression, you can develop a myocardial infarction or heart attack, which means an artery blocked. So if you see where this red arrow is, that artery is supposed to continue on all the way around in that blank space there, but it just stops. So what happens generally with a heart attack is you have some degree of blockage there, and it becomes unstable, and then this stuff latches onto it, which is clot, and stops all the blood flow. And then people come to the emergency room and we bring them immediately to the cardiac cath lab, where we go in with catheters and open the blockage to restore flow. The faster you open it, the less damage is done.